Okay, let's do
Hello,
it again.
welcome to the Dr. Tara Hogan podcast. Today we have Alex Clinton. She is a myofunctional therapist. She is a biological dental hygienist, and she works with people with their airway management. And so I'm going to have her explain all of that to you because this might be new to you. And so welcome, Alex. I can't wait to talk to you today.
Thank you. I really appreciate you reaching out and asking me to be here because this is a field that a lot of people maybe have just dipped their toe in. And they're like, wait a minute, my child snores, mouth breathes, has issues with sleeping, or doesn't wake up well rested, may have extended bedwetting, and a really hard time getting out of bed in the morning, or management issues. Like they're very dysregulated in their nervous system response. And we usually say that's wired and tired. And I know with your background as a chiropractor, you are supporting kids, families, and moms all through the life cycle of that little human. So I feel really fortunate because as a dental hygienist, that's where my journey started. And actually, take a step back. My dad's a dentist. He is semi-retired. He's a biological dentist, so he's looking at things from a holistic health standpoint. And he was an airway-centric dentist before that term even existed over 30 years ago. He was looking at chronic pain, sleep issues, and massive dental destruction and disease way early on in his career because he was noticing that traditional models were just not working for people. So my mom is also a nurse and a nutritionist, and they created a holistic approach to dentistry in their practice before they sold in 2022 and retired. So that's why I started what I'm doing now as a myofunctional therapist, airway coach, and biological holistic dental coach, because I want to help families and guide them through this journey. As you know, I know you have a lot of children and you're a busy mom and practitioner. So I'm curious, how did you find out about this journey and start it with your own children?
So this subject, I'm really excited to talk to you today because I got into pediatric work. Really, I had always wanted to, but when I had my second child, there were a lot of issues arising, and it really propelled me to learn more. And I'm really excited to talk to you today because this particular child has had some breathing issues. And yeah, it's just been a huge learning journey for me. And I'm really excited to pick your brain about what's going on with him right now because he's 14 now, and we've done all this work. We've done all this, we've done chiropractic, we've done brain-based Dr. Malello's, brain training. We've done neurofeedback. We've done gut fixing. We've done a million and one things to help this kid. And now we're really, really looking at what's going on with his airway. I've always suspected that he had some tethered oral tissues. Looking back at how he was nursing, he was a super slow, sleepy nurser. He would be on there for hours, and he probably has had some oral ties. He's never breathed great at night. So that's kind of like, he is a big reason of why I started on the path I'm on. And then the more kids you have, the more like, I really believe they come here to help us heal and help us learn. And so they've set me on this real journey of, just trying to get my family healthy. But then once I've been through and learned this, I get to share it with my community and with my practice members. So yeah, that's kind of like where I've started out.
Awesome. And that's the biggest questions and red flags that I get from parents.
Mm-hmm.
They're coming to me because they notice their child doesn't breathe well through their nose. They don't sleep well. They don't wake up feeling well rested. They may have irritability, like their goalposts for stress are really short and limited, and they have gut issues, and they have all these things happening. And like you said, I have a really great client base of parents that get this. They've done the nutrition, they've done the body work, they've done all the things. They throw their kids outside. They may be homeschooling them. They may be processing their own meat, fruit, veggies, buying from local farmers markets. And then they come to see me and they're like, I did everything. Like, why is my still struggling? And it's because the breathing component was never properly assessed, addressed, and supported. because no one at the time was really talking about breathing the
Yeah.
way that they are now. So I feel like since 2020, that just opened up the floodgates primarily for parents.
Oh,
And I tell parents, you are the drivers of the airway centric movement in dentistry. Without the moms banging on the
yeah,
doors and saying, help me,
absolutely.
my kid is not breathing
Yeah.
well, not sleeping, their teeth are a disaster, where can I start?
Yeah. So I want to ask a couple of things about that because right now, because we've done so many good things for him, and we've had like these moments of like peace and development, and he's really thriving, and then it's like he started hitting like his hormone changes, and then he cannot get out of bed in the morning. Like he is asleep. And I that's one of like our main issues right now is like he can't wake up in the morning. So I really wanted to kind of ask you like what exactly is it about breathing that can have somebody really struggling in the morning or like just to get that deep sleep? Like how are those things related?
And the next question I'd ask is, how is your sleep when you get up in the morning, or your husband gets up in the morning, or your friends, family members? How do they feel when they get up? Is it a struggle? Do you have to set an alarm? Do you push the alarm a few times? The problem is we're told this is normal. We think this
Yeah.
is normal. If
Right.
we have that issue, and
Yeah.
our parents had that issue when we were growing up, and our grandparents had that issue, and our friends had that issue, how is this a problem? It's considered normal.
Mm.
It's not normal. So your normal is all that you know, and your doctor's normal, and your chiropractor's normal. And if everybody's not waking up and feeling well rested, they don't even think that there's another way to be. I
Yeah.
didn't even know. I took this training in 2019 with Patrick McCowan. He's the owner of the Oxygen Advantage. He teaches breathing programs. And that was the course that changed my life, because up until the age of 30, I would sound the alarm off 10 times every morning. I would drag myself out of bed. I could not get out of bed before 9 or 10 o'clock. It was a struggle. And I used to want to slap people that would say, I spring out of bed in the morning, my alarm doesn't wake me up, I am peppy and ready to start my day.
Mhm.
That is me now. I set an alarm because I have a busy life, but I always get up before my alarm. And that's before 6 or 6:30 a.m., depending on what I have scheduled that day.
Mhm.
And it was because of that course initially. I flew down to New York City because I'm in Canada, and I took a 4-day intensive breathing course with Patrick McCowan. And while I'm teaching practitioners, I always tell them, you can take the course online, but until you feel it and feel the difference of what he literally puts you through your paces, it was a game changer for me. It changed my life. I actually do more breathing optimization to support parents and kids and practitioners on this level before we even start a myofunctional program, because it doesn't matter what your lips are like or how your tongue's sitting or how many exercises you do if you can't breathe through your nose, because then your mouth is going to stay open. So the first thing I do, if I was to see your child, whether they are really young, a teenager or an adult or even a retiree, I would start with an initial assessment. So I'm checking, what does their lips feel like? Do they have a lot of tension to keep their lips closed? That tells me that the mouth is more open than closed. I'm also checking the breathing. I'm checking to see how much airflow actually comes out of their nose, because there's only so much we can do from a natural perspective to get the nose clean. And if there's more of a structural issue where they have enlarged tonsils and adenoids, that lymphatic tissue that's back here we can't see for the
Mhm.
adenoids, the tonsils is what we can see at the back of the throat if they're inflamed. So if that is looking large, and if there's some red flags about picky eating, not wanting to chew a lot, maybe chewing with their mouth open and they're breathing and chewing at the same time, and at rest, is their mouth hanging wide
Yeah.
open? And when they sleep, I'm getting parents to take a video of their child about 90 minutes into sleep. What does their posture look like? Are they sleeping restfully, or are they arched back with their mouth hanging wide open?
Yeah.
And get that video, get that sound, because that is a great representation of how your child is sleeping. Because your child could be sleeping 8, 9, 10, 12 hours a night, but if they're not getting restorative sleep, it doesn't matter. Like as a teenager, I would sleep 8 hours and then I'd wake up and I'd be like, oh, it's a weekend. Let's do another 2 and see how I feel. And I still didn't feel any better because I wasn't getting into the proper stages of sleep.
Mm.
So there's 3 stages: light, deep, and REM sleep. So if we were to track his sleep cycles, I would want to know how long is he staying in light, deep, and REM sleep?
Yeah.
Is he getting into those deeper restorative sleep patterns? Because if he isn't, it doesn't matter how long he's in bed for.
Yeah. Yeah. Oh, that's
Still not
fascinating. You mentioned tongue position because I have recently learned that you cannot fully go into parasympathetics unless your tongue is in a certain place on the roof of your mouth. And so to think about that, like I'm thinking about that too. And I've done a lot of jaw work with babies and kiddos who are having chewing problems and just doing, like upper cervical work with them, doing some muscular release around the jaw. And these are things that I'm trained in that I see help kiddos, but not, like there's so many moving parts. So what can you say about tongue position? Like just the position of the mouth to get rest. Like what is the position that is optimal for that?
I could spend the whole hour talking about this. But when
I now realize like this is such a deep rabbit hole. Like we're not going to get to touch on everything that I want to touch on, but
that's okay.
Yeah.
That's okay. I can always come back. So when we're talking about proper oral rest posture, what does that mean? So it means the lips are sealed, no activation of the facial muscles. So if you initially get your children to close their lips, it should look relaxed.
Mm-hmm.
If there's a lot of tension, then you know the mouth is more open and closed. The moment the mouth opens, where's the tongue? Down.
Yeah.
So it's not up. The tongue is actually nature's expander. It's the strongest muscle in the body for its size. So when the tongue is resting up, the teeth actually come around the tongue. So when you see narrow faces and narrow jaws, that garage for the tongue being the car, the garage is too narrow, so the tongue has to squeeze in there. And now that's not going to be a comfortable place. And that can start really early on. Like I've seen children that are 4, 5, 6 years old with narrow garages for their tongue. So then they're constantly open and the tongue goes back and falls back into the airway. So we're looking at external signs. Those are some of them. And then the other thing we do is look inside the mouth. And I'm trying to get more of my body workers, chiropractors, osteopaths, craniosacral therapists. I'm trying to get them to put gloves on and go inside the mouth, take a popsicle stick, look at the tonsils. If the tonsils are huge, we need to talk about that. We need to get lymphatic drainage and things flowing. We need to do a whole bunch of other things. But then the tongue, get them to lift their tongue up. This is really hard for a lot of people, including adults.
Yeah.
So when you get them to open wide and lift their tongue up, there's an assessment that we do to see how restricted that tongue is. But it's not just about the piece of tissue and the restriction. It's how is the tongue moving in space from side to side, up and down, front to back, and making some of the basic movements that we do on a day-to-day basis, like chewing, eating, swallowing, and speech.
Yeah. So with that, I've seen patients, little like babies who start to have tooth decay when they're just solely breastfed. Is this a part of that? I've heard maybe air on the teeth because they can't close their mouth and there's no saliva. What is that all about? Is there any truth to that?
It's multifactorial. So we have to go into different silos when we talk about decay in baby teeth. So to address what you just spoke about was mouth breathing. When the mouth is open and you're breathing through your mouth, you dry out the environment. So the oral microbiome becomes acidic, the teeth become dry, and there's no saliva bathing the teeth.
Gotcha.
Saliva is nature's toothpaste.
Gotcha.
Saliva is the best toothpaste we can use. So I recommend little chewing devices to get kids chewing after they eat, because when you chew, you produce more saliva and then you clean your teeth naturally that way.
Wow, that is super cool.
So you want that. You want the saliva, you want the proper pH and acidity in the mouth, because if the mouth stays acidic, the teeth cannot every time we eat, we get an acidic, like an acid attack. So we need to
Yeah.
be able to balance that out. And if kids are snacking too much, if moms are snacking too much, we're
Yeah.
seeing that a lot now.
Yeah.
These moms are breastfeeding and they think, baby's eating, I'm going to eat. And then we see a lot of cavities in women because they're having multiple acid attacks instead of getting what they need with 3 meals and a couple
Yeah.
snacks a day. So
Oh
that's
my.
one piece.
Yeah. Yeah.
The other piece, which I'm going to touch on, so hold that thought, is what was mom's nutrition like when she was pregnant?
Hmm.
Baby teeth develop in utero. If mom's deficient in utero, those cavities show up in the baby teeth when the child is 2, 3, 4, 5.
Okay.
That's a deficiency in mama.
Yeah.
We need to up the mineral content. We need to make sure she's absorbing what she needs. I want to know what their vitamin D level is when they're pregnant so that those baby teeth have the best start at life. When I see kids with baby teeth that are decayed, now I'm telling mom the adult teeth are underneath the bone. We're developing the adult teeth right now. So don't get discouraged because we can't go back in time. We can't change your nutrition in utero right now. You were
Yes.
deficient for a reason because of our food systems. Our food systems are depleted,
Yeah.
even the organic, natural, all the things.
Mhm.
So if I can catch moms like you do pre and when
Yeah.
they're pregnant and up that,
Yeah.
then we see the benefits 2 to 3 years later when that child develops all their baby teeth.
Yeah. So what would you say is the most deficient? Like, what are the major components that mom needs on board during pregnancy to build healthy teeth?
We need our essential nutrients and minerals, in my opinion. Now, this can be a hot topic. I used to work in Western Canada where there was a big certain culture, like religious culture, that was very vegetarian based.
Yeah.
And when I tried to educate about getting the essential amino acids, minerals, nutrients, they gave me a really hard time and pushed back. So what I realized is nutrition is a religion and you have to see where people are at
Yeah. Mm-hmm.
before you can give recommendations. So I do have families that are on the carnivore, I call it, I'm a localvore, so I eat what's local. So I eat more seafood when I'm on the West Coast. When I'm Eastern, Central Canada, the US, I'm eating more meat-based products because that's what's accessible to me.
Yeah.
So I'm a localvore. But then we have our vegetarian perspective and community as well. And depending on a numerous amount of things, what you have access to in your community, the vegetarian community is so much healthier on the West Coast because they're getting what they need from their environment versus the interior. I see a lot more depleted families.
Yeah.
Nutrition's a big topic, but you can start with working with a collaborative team. You can get certain testing done. The biggest test I recommend that we can start immediately is a vitamin D test. What's your vitamin D? The reason I asked that is I was at a conference in 2019 called Collaboration Cures. It's for all professionals, chiropractors, osteopaths, medical physicians, ENTs, sleep physicians, the dentistry field, the pediatric field, the nutrition field, and the movement space. Everybody's all under one roof. And I ran into an individual who can be a little bit controversial, but he's lovely, Dr. Joseph Mercola. And he was lost trying to get out of this massive place that we were staying in. And I asked him, I said, you know what, can I ask you one question? What would you do if you're seeing a client and you're trying to support their health and if you could only ask one question, like, well, where would you start? And he was like, where are you in Canada? And I'm like, well, we're north of the States. We're kind of slightly to the center, close to Toronto. And he's like, oh, you're vitamin D. You're severely deficient. If you're not near the equator, if you're not getting your feet in the sand or the soil, you're not getting sun on a regular basis, you're not getting it from your diet, you're using sunscreen, sunglasses, covering up, you are not getting enough vitamin D. So that moment we started integrating vitamin D testing and it made a huge difference for patients.
That's
and awesome. I know that's a whole other hot topic there, but I start with vitamin D testing through their physician or online where they can access that kit as soon as possible, where they don't have to go into a blood draw clinic and then working certain providers to optimize that they're actually absorbing it.
Yeah. I've had patients too that they don't absorb it. Like they'll take a ton of it. Do you know what's happening with that?
So there's a few things. What's their genetics? Do they have certain genetic issues that are preventing the absorption process from happening? But the other component is, what is their hydration like? Are they drinking enough water? Are they just drinking water
Yeah.
that's not filtered, that's full of heavy metals, chemicals, PFAS,
Yeah.
plastic? And then if they are filtering it, are they putting any of those minerals back? Which is
Right.
huge because you can't absorb if your fascia is dehydrated. So you have to hydrate the fascia properly so that it can support the rest of your body.
That's awesome. Yeah. Um, cool. So then moving on, I wanted to ask too, because I have also a 5-year-old tooth grinder. I want to know what you think about that and parasites, because a lot of people say that's parasites, and parasite cleansing is literally like the hottest thing out there right now. I have people asking me about it all the time. I've done some things in the past to help my kids with this before. I've done like diatomaceous earth and seen some results with that. But what is your take on teeth grinding? And also from my wheelhouse, I know teeth grinding can be a proprioceptive seeking tendency. So in kids who are sensory seekers, we'll sometimes see that because they are literally trying to meet their quota for proprioception for the day. So what are your thoughts on that?
Many different wheelhouses for grinding. So if I stay in the airway centric wheelhouse right
Yes.
now, that's seen as an airway issue.
Okay.
Because even with adults, when we see adults clench and grind their teeth, they're actually opening up their airway. So when we use certain types of orthodontic devices, orthotics, expanders, things that we do to open up the airway and allow more space for the tongue and allow the tongue to stay up, which is the myofunctional, the mouth jaw exercise program, then once we have that, hopefully the grinding will subside. However, if it continues on, maybe not as bad, maybe there's a parasite issue. And now we're into the natural health, nutrition, functional medicine space. The parasites are rampant and we actually need them to a point. They're part of our system. If we get rid of all our parasites, we're dead. So what we used to do when we were closer to nature, when people had farms and farm animals and dogs, and they lived more outside, what did they do as part of their yearly routine? They parasite cleanse their animals, their pets, and themselves. We don't do that anymore. And we travel all over the world. And we eat food that's been like shipped from all over the world.
Yeah.
So we need to be parasite cleansing ourselves at least on the seasonal changes, like at least spring and fall, doing parasite cleanses. The issue I have with parasite cleanses, if you just jump right into a parasite cleanse, I see the Herxheimer reactions. I see the rashes. I see people really struggling with that. And it's because they don't have good flow and good drainage.
Yeah.
So getting back to the water, get them drinking water that's mineral based, that has salt, that has electrolytes, that has the things that we need to hydrate the fascia. Then get the kids moving. Because kids are very sedentary these days because of our lifestyle. These technology devices are great, but they also hijack your child's ability to sense what's going on in their environment. So when we read a book, we read to a certain point and then we move. Whereas if people are on their devices, they could be looking at the device for an hour or two and not move their body at all. So the lymph and the fascia and everything is stagnant, and then they're breathing up here, so they're not getting their gut digestion moving. So in your background, you feel that sluggish digestive system. You feel that bloating. You feel all that, and you're working with that. But we have to get these kids doing these things on a regular basis so that when you give them a parasite, mold, heavy metal, they're not holding on to all of that. They're able to sweat, detox, have regular bowel movements. That's another question I ask. How many bowel movements does your child have a day? If they're having one or two, how many meals are they drinking or eating?
Yeah.
breakfast, lunch, dinner, and then how many snacks? It's usually 3. If they're having 6 times they're eating a day and only going once or twice, there's no way I
Yeah.
want them doing a cleanse.
Yeah. Absolutely. Absolutely. So what is your position? I know you did a post on mouth taping, which my husband is a fan of for sure, but you say with kids, and I never seen before, but you had like these mouth strips that had like the little hole in the middle. And we have mouth taped our oldest son, and he does seem to wake up a little more rejuvenated. Please explain to us about child mouth taping and kind of what the idea is with it and what's a safe way to do it or not do it.
This is actually sounding the alarm right now. So ENTs are freaking out because they saw the trend of lip taping, where you cover the mouth completely. And they're like, if this person has a deviated septum, if they have inflammation, like you were suffocating this child or this. So that's why I'm of the opposite mindset. I do not recommend lip taping unless you have a proper assessment and evaluation. If I do recommend lip taping, it's someone that has worked through my program for the first 30 days within a month. They've done nasal hygiene twice a day. They've been able to check their nose to see how clear it is, if they're able to get it more clear comfortably, and they're able to keep it clear before I even recommend it. And then the tape that you were mentioning, that's myo tape. That's by Patrick McCowan as well. It's like a little window frame that just goes around the lips, and it's made out of kinesiology tape. So it's stretchy, athletic tape, and it's sensitive so that it doesn't cause a reaction to the skin. Comes off nicely so kids don't cry and get upset. And you stretch it very mildly so it creates a light compression, but they're still able to open their lips, speak, drink. If they needed help, it wouldn't be something that would prevent them from being able to get help if they needed. They can take it off. And if they have a big device in their mouth, if they sleep with something in, I've had kids take the device out with the tape because it's not limiting and forcing the mouth closed. But I only recommend that once they've gone through the first month of my program, they can do a proper assessment on their child to know that this is safe. And if they're really struggling, what the next steps are to be able to get a more, observational and structural assessment with a scan so that you can actually see what's going on. And the problem in Canada is we are very limited to getting into ENTs. If your child is dying, they will help you. If your child is moderately struggling to breathe, but it's not severe enough yet, they either recommend a nasal spray that has steroid in it, or they recommend let's wait and see and reevaluate in 6 months or a year. So I'm not sure what it's like in your area of the United States, and the country of the US is very different. I have some places that are great and they're airway centric ENTs that are in this space, but then there's other areas where it's limited to get in. So ENT is always the gold standard in North America. And then seeing an airway centric dentist might be able to get the process moving a little bit quicker if it's being stalled. And then seeing someone like me, either virtually or working through my program, it gives them some tools to, show practitioners, this is what my child's struggling with. Because the ENT is seeing your kid at one day. You could have lip taped, nasal sprayed, and then brought your child in, and the ENT's like, oh, his lips are closed, he's breathing through his nose, he's fine. But then you go home and he's like they don't see that. So take videos in the car seat. Take the videos of child sleeping in their bedroom.
I feel like that's exactly what happened to us because we took him in years ago, and he literally looked at him and said everything was fine, and we were like, everything is not fine. Like back then he was doing like this, like snortling, like throat clearing through the very back of his nose and mouth. And he hasn't done that for a really long time, but we saw the ENT and they didn't find anything. So we were kind of like,
when I'm guiding parents through this, I say, get a video. Get a video. Get the sound on, get some sort of a light so that they can see the posturing. How is that child sleeping? Because those are all red flags of what's actually happening. So
That
once
makes
you have more data, then you bring it in. And I'm creating this right now as we speak. I'm going to be launching this in a couple weeks. So there'll be sheets that parents can check off to know the signs that they should be looking for. And then once they've done that, they can do an assessment themselves without seeing an airway-centric dentist or a myofunctional therapist or a breathing coach that works potentially similar to me. Once they've completed that, they have a really good sense of where they can start with their child, and they have the pictures to back it up.
Yeah, yeah, that's awesome. So, how can you tell? I mean, because I feel like when you're breathing, you can't get a good sense because you are in yourself. You can't get a good sense of how well you're breathing. I think that my husband notices when he does lay down, he has a problem breathing. So he's been wearing like these breathe right strips, which seem to help. But he's noticing that if he pulls his face down or he stretches here, he breathes better.
Isn't that interesting? So there's tension and there's congestion here. So the other thing we focus on is not just the tongue tie, it's also the lip tie.
Yeah.
What's the tension like in that area of the body? So this goes back to what his mom was supplementing with when she was pregnant. So if there was too much folic acid in those prenatal vitamins that are not natural sources, they're all synthetic, it creates more midline tension. So that's one thing I'd be looking at when I do an assessment is I would want to see, is there a lip tie that could be contributing to that amount of tension there? And if there is, what can we do naturally? And do we need to intervene with an airway-centric dentist that does releases, functional releases, not just cutting the tie for the sake of cutting?
Yeah. So how many practitioners are there like that? Because I know in my town, there are people like I won't send people to because they're snip happy and they don't do anything else other than just cut it. And then we've got like loose, flappy things that don't know what they're doing. How do you make sure you can find somebody who is like airway centric?
And that's the question I get every day. So everybody's going to have a different route into where they recommend who you see first. My recommendation is always see a myofunctional therapist first. The reason for that is they have practices either in your city or town or country. And if you don't have anyone that you're able to access, then go online and see if you can find someone that can do a virtual consultation. And from there, if you like the way they're, speaking, and they should almost be working with you, not just from an exercise perspective, but a collaboration in a team approach. And so we're like the quarterbacks. I always say that we're the quarterbacks in this field where we take the ball and we refer to all these providers. So a myofunctional therapist, whether you see them in person or virtually, should be able to take the ball and say, here's an airway-centric provider that is within an hour, within 2 hours, within 5 to 10 hours. And then that airway-centric dentist, I always recommend if you can get a virtual call with them. That is huge because sometimes they can give you additional tools that they want before they even see you. So the myofunctional therapist is saying, this is what we're seeing on a virtual call. Goes to see this airway-centric provider. The airway-centric provider is saying, great, let's see what we can do moving forward. Are you working with your medical doctor or an ENT or a sleep physician to get that train and ball rolling as well, so that you can get all those pieces? And then back to the myofunctional therapist or the airway-centric provider you're seeing. And from there, from their consulting background, they're not even doing myofunctional therapy. This is purely consulting. And then they can say, okay, I want you to take videos. I want you to take photos. I want you to check nasal patency. I want you to check airflow through the nose. I want you to start nasal hygiene. See if this is making a difference for your child. If it's not, what can we do to optimize that? Take those records from certain types of devices to help, so that when you go into your medical doctor and your ENT, they will take that maybe a little bit more seriously because they have more data. The data doesn't lie. The data gives us the whole story of what's going on, not just that one appointment. The question you asked is, how do we even start this process? So myofunctional Therapist. So how you can find a myofunctional therapist, there's three websites that I usually refer to the most. One of them is the IAOM, which is a association in the States. They have a directory of myofunctional therapists. The other directory I refer to is a big organization that I was trained under, the AOMT, the Academy of Oral Facial Myofunctional Therapy. They're also based in the States. They have a huge directory of myofunctional therapists internationally. And then I'm actually a mentor on Airway Circle. Renata is a myofunctional therapist, a dental hygienist, and she has a foundations program as well as a more advanced program for new and could be myofunctional therapists in the program and in the field for a while. And she has a directory for not just myofunctional therapists, but also dentists, chiropractors, osteopaths, like a whole team collective of providers that think airway centric. So I can give you those links so that you can link them below. There are many others. I could probably name 10 associations or more, but those are the ones I start with because they have the biggest pool. If I refer to some of the other websites, depending on where people are seeing this, they may not find any providers and they might get a little discouraged.
Yeah.
So those are the top three.
That's great. I think that's really helpful. So I wanted to ask you, because my husband brought this book home a couple of years ago, and it's a really old book. And I'm wondering if you heard of it, but it's called Why Raise Ugly Kids.
Yeah.
Have you heard that? And it's all about how like nutrition builds basically your facial structure.
Weston A. Price.
Yeah. Yeah. So what, that it reminds me of what you're doing called Building Healthy Faces. It's a lot nicer way of saying that book. It's like he brought it home. I was like, what is this book? Like, that's kind of offensive.
And that's why it probably got shelved a little bit. It's a great book, but people don't want to see that their child is struggling and that they're focusing on it from that struggle perspective. So that's why I called this first program that I'm launching as part of Building Healthy Faces. The first phase is building optimization. People don't want to be re-educated, they want to be optimized. So I'm giving people an idea of where to start, because if breathing isn't optimized first, it doesn't matter how many tongue exercises you do, you're not going to develop the face. And the biggest issue I'm seeing in this space is all these dentists are doing some amazing work, but they're putting these devices in kids' mouths at night and the kids are spitting them out because they're not breathing through their nose comfortably. And it's restricting the airway. And then they're also putting expanders in to try to build, a bigger airway. And then they're putting the devices in and the kids are spitting them out because it's still restricting the airway. It's restricting tongue space. And if the airway is still impacted up here and the back of the throat all the way down, then it doesn't matter how many of these devices you try to shove in their mouth or expand their face, you're going to see that collapsing because the tongue is nature's expander when it's up, pressing the roof of the mouth. Now, something I noticed that was really interesting, everybody talks about expansion this way. So when you finish orthodontics, you've got a great smile, but then you turn sideways. Profile. It's not great. It could be better. And you see a lot of people getting cheek and jawline and lip filler to balance that profile in the face because they don't have it naturally. My age group is doing a lot of that. So when I started incorporating more chewing with those chewing devices that I was telling you about, so the combination of chewing, tongue posture, and nasal breathing, game changer. I was seeing kids' faces change.
Yeah.
Like within 3-6 months.
The photos you have on your page are really impressive. And I have to say, I remember my face changed after I had braces. Like, not for the better. There's a look to having had orthodontics. It does change your face. And my face changed when I started going to cranial seminars. It changed drastically. Like, I have a jawline that I didn't have like 10 years ago. And that was when I started learning how to do cranial work, but I was getting worked on. And then my jawline changed. My whole facial structure changed. And I was just looking at a picture with my daughter of my oldest is 17, and I was like, oh, you were 3 months old when this picture was taken. She goes, why is your face so fat? Like, my face shape was totally different.
Exactly.
Yeah.
Exactly. That's because, and you understand this really well, we are taught in dentistry that the cranial bones fuse
Yeah.
and you can't move them. Well, there
Right.
actually is a cranial rhythm happening every time we breathe, and you can
Yeah.
feel it because of your cranial sacral background. So you were able to get that fluid moving again. And the problem with braces is it's metal and it's retractive and it prevents the cranial rhythm from happening.
Mm.
And then you take the braces off, and if you don't address the cranial rhythm after the braces come off or after the
Yeah.
expander comes out, it doesn't allow it to move, and then it doesn't develop the way that it should. And then the tongue isn't pressing up and developing this portion of the face forward.
Yeah. That's just incredible to think about.
You just mentioned my second one. So building healthy faces is for kids.
Yeah.
Building your best face is for adults.
Awesome. That's wonderful. That's so cool. I'm probably going to need to consult more with you on my family's personal issues, because we've definitely got a lot of stuff going on. And you mentioned, like, with the whole folate thing, and my husband, like, we've had his gene testing done. Yes, he's got the MTHFR thing going on. He needs green leafies and folate, like, or he's really not high functioning. Like, you can tell when he's not eating healthy. It just affects everything. Um, but yeah, I think I'm going to wrap it up here, even though I think that we could go on for, I have, yeah, so many more things that we could talk about, but um, I'm really thankful you came on here with me today. And please
Yeah.
share where people can find you. I found you on Instagram. I actually found you through Jess, who did the podcast episode about morning sickness. She said, you're into this stuff, you got to reach out to my friend Alex. So I'm really thankful that she gave me your name and I found all your stuff, because it's very timely for me. So I appreciate you coming on here today.
Thank you so much for having me. I appreciate the opportunity and being able to share more about how to build healthy faces, essentially.
Yeah, awesome. Yes, and so do you have a website as well?
Yes. So, as a myofunctional therapist, my website is functionaloralhealth.ca. That's also my Instagram handle. So, that's where the majority of the information is. I just launched Building Healthy Faces. The website is going to go live any day. So, currently at this time, it's not live, and there will be a course associated with it. So functional oral health is the one-on-one. It's the doing the initial consult, looking at the photos and videos, and then guiding families, whether they start with myo or they just need support on seeing the right providers and how to move forward with that. Building Healthy Faces is a preset program for 8 weeks, 2 months. You'll get exercises weekly. You get a sneak peek into what it's like to work with me. And then there's calls on every second week just to go over, so if there's any questions, if people are struggling with certain things. And then I want to wrap it up within that period of time, because I find after 2 months people are tired, they need a little break, they need a little reset, and then they can come back, and hopefully by that time then we can either do a one-on-one call if they want more tailored guidance for themselves or their kids or families, or they can start my phase 2, which is part of like the face gym, building the face, because building a healthy body starts with building a healthy face. We have to start there. Breathing
Yeah.
is foundational to everything we do. And if we don't breathe well, it impacts our posture, our chewing, our ability to speak, how well we're sleeping and breathing, and how well our mental health and capacity and energy levels are throughout the day.
And our, just in general, our nervous system, where we're living through our nervous system, right? So yeah, awesome. Well, that sounds like an amazing resource. I cannot wait to check it out. And Alex, thank you so much for hopping on here with me today.
Thank you.